kidneys is what we use to determine our kidney function. So the glomerular filtration rate is the measure of how well your kidneys are able to filter your blood and remove waste from your bloodstream. It's typically estimated based on a creatinine level from your blood work. There are several ways of measuring your glomerular filtration rate, but in most cases, most blood work will assess your creatinine level, and that number will then be used to estimate your glomerular filtration rate. So whenever you get blood work done, at most centers, your renal function will also be assessed. So just pay close attention to this number. What is normal kidney function? It varies depending on your age and several other factors. What's considered normal for you may be different. But in general, in adults, a normal level is anything 90 and above. In elderly patients, levels around 60 may be considered normal. So whenever you see this level, have a conversation with your medical provider, because what you are seeing may be normal for you or may be abnormal. A lot of times it's dependent on what the levels were from your previous blood work. But levels typically below 60 are considered abnormal for most people. So what is kidney failure? This is where I'll pause to see if anyone in the audience have had any experience with kidney disease or kidney failure and could share anything that they may know regarding kidney failure or what they think it means to have kidney failure.
Dr. Oppong, quick question. What one of the inputs that I think generally among some of my friends is that you generally get kidney failure from drinking in excess. Is that a myth or something that is real?
Well, it depends what you're drinking. Are you saying in terms of drinking alcohol?
I'm sorry. Yeah, in terms of alcohol, not water.
Yeah, so alcohol by itself does not cause kidney failure, but alcohol can cause diseases that can lead to kidney failure or can worsen someone's symptoms or presentation of kidney disease. But by itself, alcohol is not a toxin that is going to disrupt the function of your kidney, but it can lead to things like liver disease, which can then cause kidney disease and kidney failure.
All right. So definitely it can cause liver disease.
For sure.
That's
100%.
okay. All right, for sure, for sure. I think that actually, I think that is the question that what I've heard a lot of my friends talk about, and some of the news items. So it's more about the liver disease. All right, thank you. Kidney disease.
The liver, once you develop liver disease, that can lead to different forms of kidney disease and kidney failure, and can also make management of kidney disease and kidney failure more challenging.
All right, awesome. Thank you.
So I don't see any other comments or hands, so I'll just proceed. So kidney failure is kidney disease. First, I wanted to make the distinction that kidney disease does not equal kidney failure. So kidney failure is when you've had kidney disease that has progressed to the point that your kidneys can no longer filter and remove waste from your system adequately. You can have kidney disease, but it may not necessarily be at the point where the kidneys have failed completely. And typically, we mentioned kidney function is assessed by glomerular filtration rate. We discussed that normal levels are typically above 90, but could be normal in the 60s for elderly patients. When the glomerular filtration rate drops below 15, this is typically indicative of kidney failure. So what are some of the signs and symptoms of kidney failure? The filtration capacity, the removal of waste. When waste starts to accumulate in the bloodstream, you will typically have symptoms that we commonly refer to as uremic symptoms. What are these symptoms? Early on, patients will describe nausea, poor appetite. They may have what they classify as poor taste in the mouth. Some patients will describe it as metallic taste, fatigue, or itching. These are all related to the waste and the toxins that the kidneys would normally clear that are now accumulated in our bloodstreams. As this progresses, if it's not treated, it could lead to confusion, coma, and death. Fluid management, we mentioned that the kidneys remove excess volume through the urine. Now, if this capacity is lost, you tend to see volume overload. In patients with heart disease that have other medical problems that can lead to volume accumulation in their system, their symptoms may occur and present much earlier prior to the kidney function even getting down to that 15 level that we mentioned. It will typically start with swelling in your legs or dependent areas. So if you are typically on your feet, you're gonna see more swelling in the legs. If you are someone who's constantly recumbent, like hospitalized patients, you may see the swelling in the legs, but also in the gluteal and in the back regions. So it's a careful examination of yourself or your family members, loved ones is essential in picking this up early. Blood pressure also becomes elevated in patients that already have high blood pressure. They might see that their medications are no longer working as their blood pressure starts to become more elevated and difficult to control. In some patients, they may present with a decrease in the amount of urine that they are making daily. But I also want to clarify that not every patient is going to present with a decrease in the urine output. So simply because you are making urine does not mean that you have not lost a significant amount of your kidney function or that you are not in kidney failure. We mentioned the balance.
A quick question also here. There's also somewhat feedback in friends' discussions that if you pass urine several times, whether at night or day, then it's signs of or indication of kidney disease, if you will. How is that? Is that a myth, or that is also something that has no basis in what you're talking about?
So meaning you are waking up many times.
Yeah, several times at night, yeah.
To use the bath. Okay, so that may not necessarily be related to the actual function of your kidney, right? Because remember, the function is you're filtering, you're making the urine, and then you're avoiding it. A lot of times that's related to things related to the lower urinary system. So either you have prostate issues where whenever you urinate, you are not able to completely empty your bladder. So you have to go more often to get rid of the urine that is being made and is in your bladder. So your kidneys may be functioning okay, but you have issues getting that urine out unrelated to your kidney function. Now, if you have issues in the lower urinary tract system that progresses, that could eventually back up and affect the kidney function. But that's usually not the main etiology. So back to the electrolytes. So if you have issues balancing your electrolytes and your acid base, when patients present with kidney failure, they usually may have high potassium levels. And usually higher levels present asymptomatically, meaning the person may not have any symptoms. But as the levels become very high to dangerous levels, they may start to complain of muscle weakness. They may have some abnormal heart rhythms that could present as palpitations. And at extreme levels, it can lead to cardiac arrest, which is death. Same thing with acidosis. When the acid levels in the bloodstream get very high, a lot of times patients present without any symptoms, but at very extreme levels, they may start to have fatigue, nausea, increased heart rate, and it can progress and lead to death. So you really want to identify these things early. So regular checkups, because as I said, by the time you start having some of these symptoms, you are very late stages. So regular checkup is necessary. And then we talk about some of the hormonal capacities. For renal failure that presents acutely, meaning a patient that did not, or a person that did not have any kidney disease, but all of a sudden, because of some injury, develop kidney failure, you're not going to see some of the signs related to the hormonal capabilities of the kidneys. So a lot of times when you start to see things like anemia or extremely difficult to control blood pressure, it means that that patient has had kidney disease or kidney failure for quite a long time, and it was just coming to attention at the time of diagnosis. Now, what are the causes of kidney failure? As I mentioned, it can occur due to acute causes, so acute kidney injury that occurs either related to an infection or some toxin injections or even herbal supplements, or an obstruction to the urinary system where you have blockage, either because you have some kind of malignancy or your prostate is so enlarged that it's not allowing the urine to come out, that can lead to acute kidney failure. Is usually the symptoms related to this are usually sudden onset. So within a few days, patients will start to develop some of these symptoms that we discussed. Most commonly, patients that develop acute kidney failure related to an acute injury, it is because they probably have some underlying kidney disease that had not been diagnosed or was diagnosed but was not at the end stage. Now, end-stage kidney failure is commonly what we see. So most of kidney failure cases are related to patients that had underlying kidney disease that then progressed to kidney failure. So progression of chronic kidney disease. What are the common causes of chronic kidney disease here in America and in Ghana? The most common causes of kidney disease are diabetes and hypertension. So if you have uncontrolled diabetes, uncontrolled hypertension, especially if you have both, your chances of progressing to kidney failure are much, much higher than someone who has both diseases, but they are getting regular checkup to allow control and management of these common diseases. Now, if you develop acute kidney failure related to an acute injury that does not recover after 3 months of some kind of management, we then classify that as end-stage kidney failure, indicating that their chance of recovery is now gone. Now, what are predictors of CKD progression to kidney failure? We already mentioned some of these: poor control of diabetes, poor control of high blood pressure, obesity, and use of herbal supplements that can cause kidney injury. So anytime you get a little bit of kidney injury on top of kidney disease due to some of these chronic diseases, you are slowly declining your kidney function to the point where you get below that 15 mark we discussed. Now, how do we...
Doc, real quick, if you can go back to the previous slide and if you can make more comments on the use of herbal drugs and herbal supplements, especially in Ghana, where there are so many herbal medications that cure almost everything. If you can spend about a minute or two going over that, because I'm sure most of us are family members, who are always taking herbal supplements.
Yeah, and I'd like to comment, not just herbal supplements, but really a lot of over-the-counter drugs and herbs. You may not know what's in the medication. You may not know what's in the supplement. And it's also, you may not know if that particular supplement can lead to kidney disease or not, right? So before you take any supplements, you should discuss it with your medical provider, especially if you have some of these common diseases that we already mentioned, like diabetes and hypertension. But more importantly, if you have any underlying kidney disease, because while someone with normal kidney function may get a little bit of kidney injury and may be okay from that herbal supplement that they took, someone with underlying kidney disease, that little bit of kidney injury could push you into kidney failure. So you want to be cautious about these herbal supplements, these over-the-counter medications that we take, because in some cases, they contain substances that could be harmful to the kidneys. The other point I want to make, depending on your level of kidney function, some medications, the dose or even supplements, the dose that you have to take may need to be decreased. So if you're just taking these over-the-counter medications and supplements without consulting your medical provider, you may be taking higher doses than you need, which can then cause more harm or may be ineffective for the disease or the symptoms that you're trying to treat. So it's really critical that you just consult. I know a lot of times it sounds great because they list 100 things that this one little pill can cure, right? And we all want to feel better, so we rush to it. But discuss these with your providers before you intake.
Yes, and Dr. Pond, maybe to even add to what you just said, if you can talk a little bit about common pain medications like NSAIDs, ibuprofen, I believe that people take with every pain that they have. They keep on taking medications like pain medications every day, every other day. If you can elaborate
Yeah,
elaborate
of
on?
course. And it became a big issue because there's been quite a push to avoid opioids, which I completely agree with. But in trying to avoid opioids, a lot of people are taking these over-the-counter anti-inflammatories that we call them to treat pain. And sometimes the doses that they are taking are not necessarily too high in terms of managing their pain, but too high, and the frequency that they are taking it might be too much and can cause kidney injury. The anti-inflammatories, as Dr. Borti mentioned, like the ibuprofens, are commonly known to cause and affect kidney function. So especially in people that have underlying kidney disease, we typically advise them to avoid, or at least to not take, prior to discussion with the medical provider. I think I saw someone come off mute. Did anyone else in the audience have a question or a comment?
Yeah, we can proceed, I think.
Okay. And I don't see the chat, so if you see any questions or comments in the chat, please let me know. So how do we?
Guys, there's a chat function here. If you don't want to speak, feel free to type in your questions for Dr. Oppong, and we'll read it out to her as well on your behalf.
Okay, so now to end on our discussion of the management of kidney failure, and to tie this back in with the functions of the kidney failure. The main treatment options that we have once a patient progresses to kidney failure are medications, dietary restrictions, and in most cases, the addition or the initiation of dialysis. Dialysis is really the main method that we have in terms of treating someone who has lost the capacity to filter and excrete waste from the blood system. There is no medication that can really treat this. Some dietary restrictions could help with some of the symptoms, but essentially once you progress to this level, at some point to prolong life and for quality of life, you may require dialysis. Fluid management also in severe cases require dialysis. At the early and initial stages, medications like diuretics may be helpful. For your electrolyte abnormalities, the mainstay involves dietary restrictions, watching what you eat, but also there are some medications that can bind some of these electrolytes when they become very high and allow them to be eliminated from the system, from the body. But at very high levels of potassium or really severe acid levels in your bloodstream, you will probably need dialysis for effective management. And then in terms of the hormonal levels, dialysis in most cases will not replace any hormones. So in most cases, you're going to manage these with medications. Blood pressure control. There are patients that even prior to their kidney function get into that 15 threshold because of their kidney failure, they will require dialysis just for management because they're just not able to excrete enough volume. Also in patients that have heart disease, a lot of times they may require dialysis even prior to the kidney function getting below that 15 level. Kidney transplant is an option, but it's not an option that is available to everyone, or even in America, but more so in Ghana. The amount of kidney transplants that are being done, the number of transplant centers is not available. I think it was only last year that we had for a team that was made up of only practitioners in Ghana perform the first kidney transplant in Ghana. So it's not an option that's available. And if it is available, it tends to be very expensive if it's going to happen in Ghana. And in most cases, patients may not be a transplant candidate. And even if they are, there's an extensive prolonged wait time. I'm talking in terms of years before a kidney could become available. So really taking care of the kidneys that you are born with is your best course when it comes to kidney disease and management. And then just a few words in terms of dialysis in Ghana. There's about approximately 50 hemodialysis centers. Majority are in the greater Accra region. So if you live in the rural areas of Ghana, dialysis, like I said, is probably not an option. And the cost is about 500 to 900 Ghana cedis per session. In the US, we typically dialyze patients 3 times a week. I believe in Ghana is usually about twice a week. So every week you are paying out of pocket 900 times 2, 1,800 approximately for dialysis. And that's a difficult charge for any person to really take control of. But in the United States, if you develop renal failure, dialysis is covered and paid by the government from day one. In Ghana, is out of pocket. So an important distinction to make. Continue with the management of kidney failure. There are patients who decline to have dialysis or are not great dialysis candidates, right? So depending on what are the comorbidities that they have, they may not actually tolerate the dialysis session. And in these patients, dialysis will not be an option. Or like I mentioned, if you live in rural areas where dialysis is unavailable, or due to costs, if you are not in the United States and you are at a place like Ghana, for example, it may not be affordable for you. So the only options that we will have for management in some patients will be dietary restrictions and medications. So what are some of these dietary and fluid restrictions? So in most cases, you are not able to excrete the amount of fluid that you are putting into your body. So you need to limit the amount of fluids, and not just water. Your total daily fluid intake should be less than 2 liters. The dietary restrictions are really related to the functions of the kidney. So your kidneys are balancing your electrolytes, your potassium levels are accumulating. So you need to watch how much potassium you are putting into the system.
Dr. Oppong, a quick question. I think something caught my attention. You talked about fluid restrictions, right? So not going into alcohol or any other type, but just water. Should water intake be limited also? Because what we hear on the news is that more water is good, more water is good. Should there be a limit to that?
Yes, more water is good when you are able to remove the excess that you take in from your bloodstream, right? So we start to, and even in patients that have kidney disease, we encourage increased fluid intake. But when you get to the point where you are no longer able to take that fluid that you are putting in out of your system because your kidney function has dropped below a certain level, or you have heart disease, so your heart is not able to pump well enough to even get that fluid to the kidneys for them to remove it, you need to then start to limit the amount of fluid that you are taking in.
All right.
More important than fluid, or as important as fluid, is your salt intake, because water follows salt. So if you say, oh, great, I'm just going to cut my fluid intake to just 1.5 liters, but I'm going to eat all the salt in the world, guess what? You are still in the same boat, because you are going to retain all that little bit of water that you are putting in, because water is always going to follow salt.
All right.
So you have to restrict your.
There are a couple of questions also in the chat room.
Okay, good.
Abner has said that how long can a patient stay on dialysis? That's one question.
Yeah, so once you're on dialysis, the amount of time, you can stay on dialysis for as long as you are able to, right? So there is no set criteria that says you can only be dialyzed for 5 years or 10 years or however long. As long as you tolerate dialysis and you are healthy enough to continue dialysis, you will continue. Most of the reasons why patients come off dialysis is because they cannot tolerate, or they die on dialysis unrelated to the dialysis or the kidney failure. A lot of times it's because of heart disease that the patient had, which maybe contributed to them even developing the kidney failure in the first place. So the dialysis itself does not cause death, but factors related to why the patient developed kidney failure in the first place, such as heart disease, could lead to death, and that may be the reason why the patient is no longer on dialysis. But we typically do not discontinue dialysis for any set period of time.
All right. Thank you. Go ahead.
Was there any other questions?
Yeah, there's a couple other questions, but I think one of them is by somebody who may be medical, or has a medical background, and it reads, I intern at the dialysis unit and I realized that the daily sats used in dialysis contain basically the same portions of sodium bicarbonate and other components. In such an instance, he would like to know what are the possible issues and how can it be improved for patient-specific needs. I confess, I really don't know
Okay.
a lot of
It
it,
may
so-
be better if whoever
Yes, yes,
can come off mute and maybe ask the question so we can more
yes,
really
yeah.
understand it.
I think it's by James. James, is it possible for you to speak?
Yes, please.
Yes, please. That's good.
So what I was saying is that I'm a biomedical engineering student, actually. So I interned at a dialysis unit, and then what we did was mixing up the dialysis. You have to pick some portion of the acid and then some bicarbs.
Mhm.
Yes. So with those proportions, we simply mix the same amount for every patient. So I would like to know what are the side effects for that, and then how can it be improved for patient-specific needs, since different patients might need different portions of dialysate compositions, but then we do it the same way for everyone. So how can we improve that?
That's a
Please,
good
do you get
question.
my question?
I think you are referring to in-center hemodialysis. Is that correct? Where patients
Yes,
are
please.
going to yes. And a lot of times in terms of the dialysate, which is the fluid that is being used for the dialysis to assist in cleaning the patient's blood and removing waste and balancing some of the electrolytes and the acid levels that we previously discussed, a lot of times that composition is usually the same. How those things are then managed from patient to patient is with some of the things that I mentioned, medications and with dietary restrictions, because these companies are limited in how many changes they can do for the dialysate per patient, because in one dialysis center, different patients may require dialyzing 100 patients a day. They do not have the capacity to then make different dialyses for all those patients, right? So management then falls on the providers and the patient to make sure that these additional medications that are available and some of the dietary restrictions that are needed are in place to manage their individual needs.
Okay, thank you.
Okay, great. Thanks for coming with me to ask the question. So back to some of the dietary and fluid restrictions. So we typically advise patients to avoid salt. So as I mentioned, low salt diet is recommended. So in some cases, patients might think, well, if I cannot have regular salts, maybe let me take salt substitutes, which are low in sodium. However, these salt substitutes have high potassium. So, right, you have to also avoid high potassium foods. So it becomes very tricky, and sometimes it's challenging for patients to adhere to some of these dietary restrictions, because one food that you should avoid for sodium may also, one food that you can take because it has low sodium may be restricted because you want to avoid potassium. So it's challenging. So in most cases, at least in the United States, but also now, even in Ghana, if available and if possible, a dietitian should be involved in the care plan and in the care and management of patients before, but especially once they develop kidney failure.
Doc, real quick, I think you're a little bit biased here. You said we should avoid hot dogs. You should have mentioned we should avoid Kobe. Yeah, if you can go back to that.
Certainly avoid Kobe.
Avoid Kobe.
That should be number one on the list. So the low salt here, in parentheses, I should have put avoid Kobe.
Avoid
What's the other one? Momone, please.
Momone, Kobe,
Avoid
yes.
momone. Yeah. And in
Kobe.
general, I wanted to add that in general, fresh food that is prepared at home is better than processed food like the canned foods. But if you are cooking your fresh food with Kobe, momone, and you are putting several handfuls of salt in there, that is also not helpful. The reason why we are saying avoid the canned foods, because some of these preservatives in the canned foods have a lot of salt and potassium. But if you are doing the same thing at home, then it's counterintuitive. So low salt, Kobe, momone, all those things included. And then we have a few knowledge check questions. This is when I hope the audience can become very involved. So our first question is name, based on the conversation and discussion that we just had. If anyone, either through chat or by coming off mute and commenting, can provide us with 2 functions of the kidneys. And I can't see if
Hopefully, I'm not the only one listening. I can only name one.
Okay.
Removal of fluid and waste from the body. It's one function.
Great, and that's an important one. Can anyone else give us 1 or 2 more?
Hormones.
Good, it does produce and secrete some hormones. Good. What are some of the signs and symptoms of kidney failure?
Short breath.
Good. So you start to accumulate fluid because you're not able to urinate it out, and you can develop volume overload, which can present with shortness of breath. Any other symptoms?
Decrease urine output.
A decrease in your urine output. Good, Louisa, thank you for coming off mute.
Nausea.
Nausea, perfect. And uremic symptoms are typically the reasons why patients may need to go on dialysis, because there's no medications that can really treat uremia. So we're going to the last question. What are some common causes of end-stage kidney failure? Remember, we made the distinction between acute kidney failure that may occur from an acute injury, such as infections or toxins, and then this end-stage kidney failure that could occur from some common diseases. So can anyone tell us some of the common causes of end-stage kidney failure?
Uncontrolled BP, uncontrolled diabetes.
Diabetes, perfect. Thank you. And I will end here.
Thank you very much, Dr. Oppong, for this excellent presentation. I can see that we have 39 participants, but when we started, the number was quite low, and some of you may have missed the beginning of the presentation. We try as much as possible to be on time and respect everybody's time so that we can end within an hour for people to be able to get back to their activities for the weekend. So please.
Hi, Edward.
Yes. So
Yes,
hold on.
I managed to get some of my biomedical engineering students who are keen enthusiasts about issues of the kidney to join. So if the speaker could talk about the role of biomedical engineering and artificial intelligence when it comes to the early diagnosis and then management and then prevention, if the speaker can say something, that would be so much of interest to the biomedical engineering student who join. And if the speaker can talk to our class one of these days.
Thank you very much, Kojo. I think that was a good segue. I know as Dr. Botibedu was going on about the time and all of those things, I think we also want to look at the components that we have in the course, right? I think we can ask Dr. Oppong, we can, and then connect you with Dr. Oppong and see if it's something that is very possible to do, but that would be on a separate discussion with her. One of the things that Dr. Bedu, I think Dr. Bedu dropped off, that's why I picked up. So,
No, I'm here. So
okay, all right, then I'll leave it because
yes,
you went off my screen, so I wasn't sure.
So yes, thank you.
There's a hand
Thank you.
raised.
Yeah, there's a hand raised. Odro.
Yes, I have a quick question. Is the color of the urine deeply concerning? That's my first question. And my second question is, what's the best interval between fluid intake, like drinking water and going to bed?
Okay, so in terms of the color of the urine, yes, the color of the urine can indicate there's something going on. A lot of times it's related to concentration. So if you're not drinking a lot of water versus if you are drinking a lot of water, you may see clearer looking urine when you're drinking more water. You may see kind of tea-colored urine when you're not. But also sometimes when you have blood in the urine or you have certain sediments that are coming out of the urinary system, you may see color changes. If you see a sort of reddish looking urine, it means you have blood in the urine and you need to be evaluated right away.
And what is the appropriate color?
Normal color should be sort of a light yellow. The more darker it is, the sort of more concentrated or you're drinking enough water.
All
And I
right.
think
Thank
our
you.
idea in terms of- let's see.
Galaxy,
Okay.
see if you can mute that.
Let's hold on for the questions. I will come back to the questions. So as I was saying, we'll try to respect everybody's time. So please try and come into these presentations right on time so that you will benefit from the whole presentation. Hopefully we'll have the opportunity to do this presentation again in another forum. We all know from the beginning and from what we've talked about that what did we all pick up, or what was the most important thing, is that kidney failure cannot be picked up by looking at you or talking to somebody, even not like high blood pressure that you can go to your local CVS or have your blood pressure monitoring device at home and measure your blood pressure for you to know it's high. Kidney disease can be picked up through blood work. And that is why we come in as Mytle Health. It's essential for all of us here to have our annual checkups. And once you go for the annual checkups, you're definitely going to have blood work done. And once you have your blood work done, if your doctor finds out that your kidney function is impaired, depending on the level, they will start treatment or other investigations could be done. I will go ahead and present a quick PowerPoint slide of Mytle Health. As we all know, Mytle Health is we try to bridge the gap of healthcare between the diasporans here and our family, friends, and our loved ones back home in Ghana. And through our health provider care, we've been able to diagnose patients with chronic kidney disease back home in Ghana, for which we are currently making sure that their levels stay the same or even get better. There are medications now that you can take that will help slow the deterioration of your kidney function and, if possible, improve on what you already have. But the key to this is what? Getting your annuals done, getting the blood work done for us to be able to pick up your kidney disease to begin with. So I'll go ahead quickly and do a presentation on Mytle Health. After that, please, we open the forum for everybody to ask whatever questions they have, and we will take it on from there. So please give me a minute. Can you all see my screen?
Yes, Doc.
Okay, all right. So what is Mytle Health? That's a new way of keeping your family healthy. That family means loved ones, brothers, sisters, your friends healthy in Ghana. And as we've heard with this kidney failure, and as with most diseases, the hypertension, the diabetes, those are the two common causes of kidney failure. The sooner you pick it up and start treating it, the less likelihood that you're going to develop kidney disease. We all know that weekly cost of dialysis sessions in Ghana, this is an old chart, so I'm sure by now it's even higher. and it's much difficult and expensive and time-consuming to do dialysis in Ghana. Most of the time, the dialysis centers that are available in Ghana are located mainly in Accra and sometime in Kumasi. For sure, I know for a fact that in the whole of Western region, right now it's about 2 dialysis machines at the Kwanta Hospital. So you can just imagine how many people can get onto this machine if you realize that it takes about 3 to 4 hours or even 5 hours to dialyze one patient at a time. So the most important and the key to what all of us should take home is that we always need to make sure that we prevent kidney failure. And preventing kidney failure is doing our annuals, buying the basic package apomodine for your loved ones back home in Ghana, and that will pick up any kidney disease, diabetes. We also can pick up a lot of other diseases that we can address and help prevent future disaster. So Mytle Health's objectives, it's right here, is to make available to our patients, that's patients in Ghana, high quality and easily accessible healthcare with current best practices through verified partners and also our physician providers in Ghana. And as we go, I'll try to make this as quick as possible so we stay within the time. We have packages that we'll come to and I will explain briefly. So what's our mission? Our mission is to extend the benefit of collaboration between our medical partners globally. The objective is to ensure that most accurate methods and practices. So we all know that medicine is progressing as is like AI. New things come up every day, and we always, that's why we have doctors and like Dr. Oppong, who is presenting to us up-to-date information about kidney failure. We want to be able to extend that benefit as well to our loved ones and colleagues in Ghana. So our vision is easy access to healthcare in pursuit of good health and happiness for all. And I know there are some of the audiences here who have used our services, and I hope that maybe at the end, I will have a couple of them who will give a testimony as to what our services provided or did for the loved ones in Ghana. So I'll go through our compassion, our values, compassion, respect, excellence, and integrity, and innovation. So the most important thing is why Mytle Health, and why do we have this forum for we in the diaspora and even those in Ghana? And I have friends here also in Ghana who have been able to extend our services to. We understand that our smartphone has now become practically so valuable to us that most of us live and do everything on our smartphone. Here, most of the healthcare providers have apps that you can access your lab work on the phone on the go. So if you even get a lab work at the doctor's office, you may be able to even see your results even before the doctor is able to see the results and call you back. We don't have that in Ghana, but we want to be able to provide a forum such that we can relay that information from the workup we done in Ghana, that's this examination labs, all the investigations, to the one who is sponsoring here in the US. Because of there might be some time constraints, but we expect that within a period of 2 to 3 weeks, once somebody is signed up, we'll be able to get all the information, and the sponsor will get a call from us here and go over all the findings. And in some cases, we tend to be able to call the patient as well. So how does it work? Usually you have a sponsor who is resident abroad, be it in the US, Europe, anywhere in the world. They will go to our website or they will call our line, which will provide at the end of this presentation. And then they will pick up a package. We have basic packages, the accommodation package, which basically it's our first level of investigations that we can pick out basic things from. In some instances, the patient may already have underlying diseases and conditions for which they may need more in-depth investigation, as well as more frequent follow-ups. So in this case, we recommend a different package. So the sponsor pays for the package, and to also let you know that this is not a monthly subscription. It's a one-time payment, but we have the opportunity for people to be able to break the payments in 3 payments if that is what will work for them. So it's not a subscription. It's not a monthly, the monthly payment every month. If you go to our website and you see it, it's not a monthly payment. Okay, so you paid, and then once we receive your payment and the package, we coordinate with our office in Ghana, and your sponsor or your patient or your loved one in Ghana, let me put that way, Lord, your loved one in Ghana is contacted within 24 to 72 hours by our office in Ghana. What is unique about this? Your loved one does not need to make any appointment. They do not need to pay any money in Ghana. Once you pay the money here, no money is paid in Ghana. We will arrange for the lab drawn. In some instances, in Accra, we can do a home lab draw and arrange for appointment date and time in coordination with our providers as well as the patient, so that it's convenient to the patient. And once the patient is seen, the report will be done, and we will receive the report, and we can share the report to the sponsor as well. Our website is www.mytlehealth.com. Please, www.mytlehealth.com. When you go to our website, you will see our packages, you'll see our phone numbers over there, and if you have any questions, you can give us a call. But please remember, it's not a monthly subscription, it's a one-time payment, and the packages have different levels of care that we give. So there are ways that you can pay when you go to our website. You can pay by credit card, by PayPal, by Zelle. You can also call our number 469-722-2519, and we'll have somebody talk to you. And if you're having issues, we can process everything for you through the back end. Where are our locations? Where are we located in Ghana? We are basically located almost everywhere in Ghana. There are some regions and cities that we have partner services with, like Mytle Health, that do provide care for us, but directly through us. And in some regions, we have physician providers who will also in Accra, who can also go home and see the patient that the patient may being your loved one, your family member, your friend, or anyone. You can sponsor anybody as well. So we have all these options for the sponsors, that is we in the diaspora, to be able to take care of your loved ones at home. What are our packages? We have the basic packages. Our basic package is the accommodation package, which gives us the basic labs and the basic physical examination. However, we will be able to pick basic things like diabetes and kidney disease. And if you have kidney failure, you'll be able to also tell us that you have kidney failure. Other than that, we have the Advantage Man, Advantage Woman. I'm not going to go through everything, but you can go to our website and go through it. And if you have any questions, you can always give us a call, and I will be able to explain everything to you. I want to also leave some time for questions. So we have the different levels of packages. And there are additional tests at times, yes, when we do the basic test or our package tests, we realize that there are other things. For example, when we see a patient, and the patient has kidney failure, or the patient has chronic kidney disease. Remember, Dr. Oppong said that these are very two different things, chronic kidney disease and kidney failure. So if they are kidney failure or chronic kidney disease, at that point in time, there are other tests that we may need to do that is beyond what you have paid for. In this case, we will have a discussion with you and give you what you need to do. And if you're interested, we will be able to do that as well and try to provide the care that is needed and the help that is needed for your loved one in Ghana. I'll just play this it's an audio.
Yeah.
Sorry.
Doc, I'm not sure you have the sound there, so we can
Yeah.
leave it here and leave room for questions.
Yes. So at this
I wanted
point,
to add quickly that we don't pay for medication. So if you want to touch base on that,
yes,
the packages do not make up for medication.
yeah, the packages don't make up medications. I'm sure in our past presentations, some audience have asked about medications. Yes, medication is, in Ghana, we don't have some chain pharmacies like CVS or Walgreens that you can contract with, and you have to be careful with medications in Ghana. So we do have some recommended pharmacies in some cities that we can recommend to you, but our physicians will write the prescriptions and we will give to the patient, and the patient will be able to buy the prescriptions. But we'll make sure that we'll follow up and make sure that the patient is taking the prescriptions. I will, at this point, pause and open the forum for questions, and we'll see what time is it? 7 o'clock. It's 1 hour, but I think we'll open the forum for about 5 to 10 minutes for any questions, as well as if anyone here have used our service and would like to give a testimonial. I'll be more than happy to listen to that. Thank you.
Really to add to what Doctor just talked about, the service delivery is in Ghana, but we live here. A lot of the time we have access to primary care where we go at the very least once or twice a year. And that opportunity is not easily available to our families in Ghana. So Mytle Health, one of our objectives is to ensure that you can get a similar type of preventative support or preventative care access for your families back home. Last year, one of my school platforms, we had some of our mates who were not in a position to go to the hospital, right? Over time, we realized that if somebody will call you, you send 50, you send 100, and they don't actually go to the hospital. So this becomes a cycle where they keep continuously coming back to you. So if you're on any school platform, one of the objectives that we want to encourage you to consider is, instead of giving that individual the continuous funding every time and they don't go to the hospital or clinic for it, you can talk to us at Mytle Health and we can get into an arrangement where we can actually make sure that patient goes to see the doctor or the doctor comes to see the patient. And this is open to all schools and all associations that we all have, right? And what I just talked about, a lot of us have experienced that as well. So let's make sure we're putting the health at first, right? It's not the best to have to now give money for when somebody is not around. And so please, let's consider it. The website is mytlehealth.com. Look at the packages, and then we can talk about group procurement or group results for some of your platforms that you have. Thank you. If you have any questions and you feel like you want to ask it on the chat, please feel free to ask that, and we'll be, we'll read it out or we'll answer that question for you. Any question? I remember last year we had a patient, maybe Doc, if you can talk about it, a patient who we discovered through one of the testing with some heart issues, right? This could lead into anything, but we uncovered that during routine testing, which the patient had never done before, and probably able to save that life, right? The person is still alive, but it could have been a situation where all of a sudden we hear this person is gone and we are like, what a shock, right? Through this preventative solution that Mytle Health is providing, we're able to save a life. None of us know who or what would happen to that person, but at least it came through the service offering that we had, and we're able to find out a challenge health-wise for that particular patient.
Yes, and as I talked about earlier, we've been operating since 2022, April, and this year we've been able to diagnose patients with chronic kidney disease at different stages, which we will talk about chronic kidney disease at a point in time with the difference between kidney failure and chronic kidney disease. And also we've had patients who have had kidney failure, and it can be challenging in Ghana to treat kidney failure. And however, we were able to make sure that we kept the patients alive and stable with the help of our doctors or nephrologists back here, dietitians in Ghana, nephrologists in Ghana. So this is something that as we all know, and as we are elaborating here, making sure that we identify these conditions and these diseases sooner than later is the key to a healthy life. Most of the time, we think that we are healthy, but as we walk around, we may have diseases that are brewing in us. Life is that, yes, we all are prone to have diseases. We all are prone to have diabetes, hypertension. The older you grow, the likelihood of you becoming diabetic, becoming hypertensive, and with some of us also do have family members and have the genes in us that predispose us to higher incidence of diabetes, hypertension, and these diseases. So both here and home. So we encourage that we all do our annuals. However, if you have, we encourage to family back, your loved ones back home. As Kojo said, most of the time people ask us of money. We are not feeling well. We want to go to the hospital, and they'll go, and then you ask them, Kwesi, whatever, Kwesi or Kojo, when you went to the hospital, what happened? And they won't be able to tell you anything about what happened in the hospital, whether they went to the hospital, they can't even tell you. If you come through us, be rest assured that they're going to get the evaluation that they need, and you will have the report that you have the report to show that they actually went. And so it's important for us to kind of stress on that once you come through us, yes, you will definitely have your loved one seen.
All right. I wanted to also share that we have health updates that we are putting on our social media handles. So we'll entreat you to follow our social media handles to get more health tidbits on our TikTok and other platforms on our Facebook. Secondly, I don't know if it's Doc or Kojo, the gentleman who spoke about the bioengineering students. I don't know who knows him, if we can connect with him.
I know him. I will
Okay,
contact him.
okay. I wanted so that
We'll-
we don't hang up and forget about him, so
No.
we can,
Yes, I know. So we'll take care of him. And
okay.
also to add to what Madam Josephine just talked about, our social media handles. This presentation was broadcasted live to Facebook and YouTube, and the recorded version, the full recorded version will be there. So if you missed the early part of it, please go back to our YouTube channel, our Facebook, and you'll be able to play back the whole presentation. And if you have any questions later on, please feel free to contact us and we'll be able to answer your questions. I think it's 7:08.
Yes, Doc, before we wrap up, I would like to kind of play how the music, Josephine, is it possible that you can share how the Mytle Health package works, or how the whole solution works with our video that's on our website? I'm a host now. I wanted to share that quickly with everybody so that.
No, I'm on. I don't have any access, so I can't share.
Please,
Yeah.
when you get onto our website, mytlehealth.com, click on how it works, and you will get a short 40-second video on how the entire process is. Once you buy the package, this is not a subscription. You buy that package and we utilize the services or functions that are in that package for your family member in Ghana. And that's it. We do not charge you monthly. We do not come to you for additional unless we've talked to you on where the patient is. And I think one of the most important functions or most important features about the service is that when your family member goes to see a medical officer in Ghana, when you pay for them to go to see that, for the most part, when they come back and we ask them, what did the doctor say? That whole conversation of what happened to the patient is lost in translation a lot of the time, or they may not even have been able to ask them any question, right? But what Mytle Health Services does is that we're in connection, in contact with the doctors back in Ghana, and what they would do that based on HIPAA laws or laws here in the United States, your family member would have to give authorization for the doctors we have on our solution to call you and discuss what next, which is very, very important. What next after the visit? So you're able to share and understand what is going on with your family member, and you're not in the dark about it. And I think that is one of the most important features that a lot of our past and previous customers are talking about that they really, really enjoy. So if you face previous challenges, this is one of the ways in which we can help resolve that.
Thank you very much, Kojo, and I hope that you can see my screen. Let me make sure that I think it's 7. I don't know if I added it with audio yet, but it's 7:00, 7:10, and
Doc, somebody asked about emergency. If you can cover that real quick.
yeah. So I will play the.
Your mom is sick and has been to the doctor a few times, but you cannot get her or anyone to tell you the diagnosis. You sent money home for your father to have a medical checkup, and he ends up waiting several hours to see a doctor. You have tried to convince your diabetic brother in Ghana to have an annual health checkup, but have not been successful. Mytle Health Solutions to the challenges you face in trying to get medical support for your family in Ghana. Have partnered with Sanford Clinics to introduce a subscription-based healthcare plan for your loved ones. We currently offer services in 5 regions. You or your beneficiary can schedule the appointment on our website or call our Ghana support line. We remind you up to 24 to 48 hours before the scheduled appointment. Mytle Health offers secured access to health records, coordination of care, medical reviews by our U.S.-based medical directors, efficient and on-time appointments, excellent customer service from doctors. You can find more information on our website or by calling our support line. Mytle Health, the new way of keeping your family healthy.
I'm sure everybody heard the video. That's on our website. So please visit our website, mytlehealth.com, and also ask your friends that you know, your family members here, to also visit our website. You can send it to them for them to take a look at it. Thank you very much, all of you, and hope that in the near future, we'll also come back with another medical presentation. Thank you for your time.
All right. Have a wonderful evening.
Your mom is sick and has been to the doctor a few times, but you cannot get her or anyone to tell you the diagnosis. You sent money home for your father to have a medical checkup, and he ends up waiting several hours to see a doctor. You have tried to convince your diabetic brother in Ghana to have an annual health checkup, but have not been successful. Mytle Health Solutions to the challenges you face in trying to get medical support for your family. We currently offer services in 5 regions. You or your beneficiary can schedule the appointment on our website or call our Ghana support line. We remind you up to 24 to 48 hours before the scheduled appointment. Mytle Health offers secured access to health records, coordination of care, medical reviews by our U.S.-based medical directors, efficient and on-time appointments, excellent customer service from doctors. You can find more information on our website or by calling our support line. Mytle Health, the new way of keeping your family healthy.
Hey, Doc, long time. Can tell he's been probably like over 30 years.